Welcome to my channel, BodyTalk. Breathing becomes challenging due to airflow blockage caused by chronic inflammatory lung disease, COPD. It includes ailments like chronic bronchitis and emphysema. Important traits: chronic inflammation, mucus formation, and lung damage too. The airways and air sacs are the hallmarks of COPD. Signs and symptoms. The symptoms of COPD frequently don't show up until significant lung damage has been done. Over time, symptoms typically get worse, particularly if smoking or other irritating exposures persist. Having trouble catching your breath, particularly when engaging in vigorous activity, is one of the symptoms of COPD. Whistling or wheezing. Noises during respiration. Persistent cough that could produce a lot of mucus. The mucus could be greenish, yellow, white, or clear. Heaviness or tightness in the chest. Feeling extremely exhausted or lacking energy. Regular infections of the lungs. Unintentionally losing weight. As the illness progresses, this could occur. Ankle, foot, or leg swelling. Reasons. Tobacco usage is the primary cause of COPD in developed nations. People in the developing countries who live in dwellings with poor ventilation and are exposed to fumes from burning fuel for cooking and heating frequently acquires COPD. Another cause of COPD is prolonged exposure to chemical dusts, fumes, and vapors at work. Long-term smokers may not always exhibit the symptoms of COPD, but they may still have lung damage that impairs their ability to breathe. Before a more comprehensive examination reveals a different diagnosis. Some smokers develop less frequent lung problems that could be mistaken for COPD. Risk elements. Here are some risk elements for COPD. Number 1. Smoking. One of the risk factors for COPD is tobacco smoke. Smoking cigarettes for a long time is the major risk factor for COPD. Your risk increases with the number of years and packs you smoke. Smoking marijuana, pipes, and cigars may also increase your risk. COPD is also a problem for those who inhale a lot of secondhand smoke. No. 2. Asthma. The illness known as asthma causes the airways to constrict, swell, and sometimes generate more mucus. One risk factor for COPD development could be asthma. Smoking and asthma together further increase the risk of COPD. Numerous issues can arise from COPD, such as Number 1. Infections of the lungs. Colds, the flu, and pneumonia are more common. In people with COPD, any respiratory infection has the potential to worsen lung tissue, damage, and make breathing considerably more difficult. No. 2. Heart issues. COPD can increase the risk of heart disease, including heart attacks. For unclear reasons. No. 3. Cancer of the lung. Lung cancer is more likely to strike those with COPD. Prevention, avoidance in contrast to certain other illnesses. COPD frequently has a known cause and a known preventative measure. Smoking cigarette smoking is typically directly associated with COPD. Avoiding smoking is the greatest approach to avoid developing COPD. Quitting smoking today can help people with COPD slow down the rate at which their illness deteriorates. You can take the following actions to help avoid COPD-related complications. 2. Reduce your risk of lung cancer and heart disease. Stop smoking. To reduce your risk of contracting some infections, get vaccinated against pneumococcal pneumonia and the flu each year. Additionally, discuss when you require the RSV and COVID-19 vaccines with your physician or other healthcare provider. If you're enjoying this video, please subscribe my BodyTalk channel for more health insights.